Obesity and overweight are now global epidemics, with more than 1 billion adults affected worldwide. Of these, at least 300 million are obese. In the Philippines, about 500,000 Filipinos are suffering from clinically significant obesity.
We used to do a nutrition surveillance for the past 10 years in St. Luke's. And while doing the surveillance, we were seeing a lot of overweight and obese patients. And so then we started the weight management center. It so happened it coincided likewise with the increasing number of obese patients in the country, in the Philippines. So it actually encompasses all age groups.
The obesity situation in the Philippines is really increasing. From the last survey, which was done in 2003, 24%. Now it has increased to about 28% of obesity and overweight of people in the Philippines. So it's really a problem. We're getting there. We're getting a big problem of obese and overweight patients in the Philippines right now.
Maybe I guess the best way to explain that is the fast food lifestyle that we have right now. So it's the westernization of our culture. If before you used to cook a lot at home and eat so-called healthy foods, now because of the fast-paced lifestyle that we have, they just stop somewhere and get something, grab a bite to eat. So the choices are not so nice with regards to food.
Obesity and overweight increase the risk of diabetes, cardiovascular disease, hypertension and stroke, and certain forms of cancer.
Obesity means that you have increased fat in your body, okay? And this is the weight let's say when you talk about a weight management center, it's not because you want to manage weight, it's actually because you manage the amount of fat. So this fat likewise is associated with a lot of inflammation in the body, causing the other comorbid diseases associated with obesity. So that's the heart disease, the hypertension, and all those stuff, and maybe even diabetes.
So most patients who are overweight and obese will also have slight glucose intolerance or diabetes. They will have some hypertension, tumataas ang blood pressure nila. They will also have increase of lipids, which is actually atherogenic and will cause heart problems.
Unfortunately, while most people are aware that they need to lose weight, most of them try to do so by using fad diets and clinically unproven methods.
Well, there's a lot that we see now in the market. We see a lot of people going for quick remedies, what we call diet fixes. So these people will go an extreme starvation diet. This will make them lose weight for a while because they're not eating, but it's not a metabolically safe procedure for them. Some of them will undergo what we call other kinds of diets, which are actually not proven. Atkins diet, South Beach diet, all of these diets, or in fact, will be in names which are really very difficult to assess. No, these patients will be following these diets for a while, and they will lose weight, but eventually they will gain back the weight.
A common way to lose weight would be skipping meals, which is not very healthy, all right? Thinking that for you to have a good way to lose weight, you don't need to exercise.
What we recommend is a holistic approach to the treatment of weight loss. So one would be one which is scientifically validated. So what we ask our patients is to go for a diet and exercise. So hypocaloric diet, so the volume of the food that they're eating will be so much decreased. We ask them to do food recall, and then we ask them to jot down the food that they're eating and see what foods bad foods that they're eating, and ask them to either cut it down or decrease the intake of these kinds of bad food.
St. Luke's Obesity and Weight Management Center is committed to providing the latest in pediatric and adult weight management care. Its team of experts is dedicated to helping people live healthier lives. At St. Luke's, you are assured that the latest medical approach and proven techniques in effective weight management are made available to you.
Well, in St. Luke's, we try to evaluate each patient individually and try to take a look at all the aspects of his whole being. So doctors take a look at our patients, trying to see if there are other comorbid diseases or other diseases that we need to address prior to or while the patient is undergoing the therapeutic program for weight loss. So once you're in the gym, likewise, while you're exercising, somebody is there, a physiatrist is there taking a look at how you're doing your exercise, if you're doing it right. And coupled with that, you likewise see the dietitian who prescribes the right amount of food that you will take, the right choices of food. So in totality, there's a complete management of the person, not just one aspect of the diet.
Well, we are a patient-centric center. So our patient is the center of all what we're doing here, of all the activities and the things that we're doing in the center. So our patient is really central. So we look after the patient's welfare. We look after the patient. Our vision is to make them lose weight. And we will exhaust all possibilities to do that through the team approach. And we're in a safe manner. And if we do that safely, in a timely and good manner, in a way that will make them lose weight with less of the side effects, then we are successful in doing that.
With a multidisciplinary approach, combining one-on-one lifestyle counseling, professional support, guidance on nutrition and exercise, the center helps patients stick to their weight management plans in order to achieve their goals.
We have programs here which will help them. In fact, we have extended programs, therapeutic programs for them, make them maintain the weight loss through exercise. And then we ask them to come in for a visit with our dietitians, our dietitians will constantly check on whether they're following the diet plan that they are given. And also we ask some of our health professionals do occasionally call them up and find out what's happening with them at home and what they're doing, and then to give us a visit so that we will be able to help them if they have problems. In that instance, we're able to help them maintain the weight loss that they have achieved during the time that they were in the program here at St. Luke's. We have nutrition counseling for our patients by our dietitian. We have the therapeutic packages for our patients wherein they undergo whether a 6-month program of weight loss, and they will be seen by a group of doctors, dietitians, health professionals, our physiatrists or exercise physiologists who will help them undergo weight loss through safe exercise programs. And then also we have a team of cardiologists and then blood tests also. We also have our pre-bariatric package for those patients undergoing bariatric surgery where we assess them if they're ready to undergo the procedure, as well as also the bariatric package itself. We have that as well. And then also we have the maintenance package wherein we try to put the patients in a long-term program so that the weight loss that they achieved at the start they will have more weight loss, or they will maintain the weight loss that they have achieved initially.
In the weight management center, we have this very well-trained dietitians, dietitians. Not only are they trained as a nutrition dietitian, they likewise have undergone training in the weight management center back in QC. We likewise have physiatrists, the physical therapists, and we also have a sports therapist there. So he takes a look at the kind of exercises you're doing. And then we have multi-specialty doctors. So if, let's say, you have a problem with the heart, we have a cardiologist to take a look at you. We have cardiac rehab specialists. We likewise have doctors who take care of your problems in the lungs, the pulmonologist and pulmonary rehab specialist. Coupled with our team likewise are the endocrinologists, which I know you're very familiar with because of the associated other endocrine problems in obese patients. We have nutrition support specialists, which are actually doctors who take a look at the nutrition intake of these patients and if they're doing it right. I guess that's that combination of doctors.
44% of our patients who really come into our center actually lose 5 to 10% of their weight. And this is perhaps the best way to lose weight. It's about 5 to 10%, because if you lose weight by 5 to 10%, this is the safe way to lose weight initially.
Our weight management center does not only cater to the obese or overweight people. We likewise cater to those who are underweight who want to gain weight or maybe add more pounds to themselves and maybe look good. We try to take a look at the totality of the person. So for you to be healthy, our common standard is the ideal body weight, or our healthy fitness or muscle fitness. So we offer all of these programs to those underweight people up to the overweight and obese people likewise.
The St. Luke's Obesity and Weight Management Center, helping people lead healthier lives. Ultimately, it is expertise.